My name is Dr. Hillel Mazansky, specializing in guided imagery, guided visualization, medical hypnosis, nutrition, and exercise. Today I'm going to speak about a cancer that is very common in men, and that is prostate cancer. Breast cancer is as common in females as prostate cancer is in males. The prostate gland is that small walnut-sized gland that's at the base of the bladder, and its function is to secrete semen when one has sexual intercourse. The ejaculate, the semen, is made in the prostate gland. Prostate cancer is extremely common, especially in the African American population. It is also hereditary. In other words, the father gives it to the son to the son, and so on and so forth. Symptoms of prostate cancer are difficulty with urination, frequent urination, blood in the urine or in the semen. And it is the blood that is most probably the most important symptom, because those other symptoms that I mentioned can also come with BPH, or benign prostatic hypertrophy, which is an enlargement of the prostate gland and comes in people starts developing in people over the age of 55. BPH, or benign prostate hypertrophy, does not develop into prostate cancer. Now, prostate cancer causes are the following. First of all, age. Well, one cannot do anything about age. 2, a low vitamin D level. 3, if you eat a large amount of saturated fat, whether it's meat or cheese or dairy, that can precipitate you from developing prostate cancer. If you suspect you might have cancer, you go to the physician, who does what is called the DRE, digital rectal exam, to feel if there are any knots or nodes, and then does a blood test called the PSA, prostate specific antigen, to see if that's raised or not. The normal value of the PSA is 4. But it does increase with age, up to 10. So one must not be overly concerned if you're older and it does go up to 10. However, that does not mean you don't have prostate cancer. In that case, your doctor will do a biopsy beneath your scrotum into the prostate gland and take out a piece and evaluate it. Now, the prostate cancer is staged. Stage 1 is when it's in the prostate gland itself. 2 is when there is spread from the primary site. 3, if it's spread up till the wall. And stage 4, if it's spread from without. Well, naturally, the higher the staging, the worse your prognosis is. There's also something called the Gleason score, where they count what your number is on biopsy. I won't go into that because it's too detailed. Suffice it to say, there is a Gleason score that is done. Once you have prostate cancer, what do you need to do? 1, there's something called watchful waiting, because some cancers grow extremely slowly, that you watch it and come every 6 months and feel the size of the node and get a PSA. And if it's not rising too quickly, that's not an aggressive type of cancer. The next thing that will be done after the biopsy, if cancer is positive, there are various alternatives of treatment. The one can be a radical prostatectomy, where the entire prostate is removed, but the nerves are spared so that you can still have sexual intercourse later. The next thing is chemotherapy. where various chemotherapy drugs are used to give for that. But before they go to chemotherapy, they use hormone replacement. Those hormone replacement drugs are used to suppress the testosterone. The problem with those drugs are that you can gain weight and your breasts can enlarge and you can get hot flashes, just the same as in females. The next way of treating the prostate cancer is cryotherapy, where the prostate gland is frozen. The cancer is frozen with a method where you go through the rectum and freeze it. And the latest kid on the block for the last few years has been a prostate cancer vaccine, the most common one known as Provenge. And that's being used with more frequency today. But how can you prevent getting the cancer? And that's what I want to talk to you about. First of all, research out of UCSD showed that everybody should have 5,000 units of vitamin D every day. I see a tremendous amount of cancer patients, all of whom have got low vitamin D. Number 2, drink at least 4 cups of green tea every day. Caffeinated or decaffeinated, it makes no difference. And have 2 heaping tablespoons of ground organic flax seeds. Ground organic flax seeds, 4 cups of green tea a day, and 500 milligrams of vitamin D3 every day after food. You won't get prostate cancer, and your wife should not either, or your partner. My name is Dr. Hillel Mazansky, and I thank you for listening to the Health Tip.